everyone. The topic that I am going to discuss with you today is the cardiac failure drug treatment. This is a brief overview of which drugs are compulsory and important in reducing the mortality of the heart failure and in management of the patient. So first of all, the mortality reducing drug that we will talk about are 4 drugs: ACE inhibitor, beta blockers, spironolactone and hydrolazine with nitrates should be given to the patient. These all drugs reduce the long-term mortality in the patient with the cardiac failure. So these are actually the mandatory drugs in the patients unless and until there is an absolute contraindication for that. First line drug is ACE inhibitor and beta blocker should be started in all patients with cardiac failure depending upon the condition of the failure, and they should be slowly up titrated according to the response and according to the any other complications that patient might develop. So these 2 drugs should be started right away. Second line drug is aldosterone receptor antagonist, angiotensin receptor blocker or hydrolazine with nitrates. These all are second line drugs in case the patient is not being controlled in these 2 drugs and is still symptomatic. So any of these drugs can be started. And then third line is the if the patient with the these 2 drugs that have been started, first and second line, and symptoms still persisting, then digoxin along or cardiac resynchronization therapy should be considered according to the patient's condition. It should be remembered that digoxin it does not decreases the mortality in the patient with cardiac failure. It is inotropic drug and basically gives the symptomatic relief to the patient and improves his functional capacity. And it is basically indicated in the patients with cardiac failure along with atrial fibrillation, so dual benefit will be obtained with this. The third one is diuretics also give the symptomatic relief. Root diuretic like furosemide should be given to the patient to improve the condition. Then patient should be vaccinated. Annually influenza vaccination should be given to the patient, and one of pneumococcal vaccine. Single shot is enough for the adults, but in case if the patient has acyclemia, splenic dysfunction or chronic kidney disease, so in these 3 conditions 5 yearly booster of the pneumococcal vaccine should be given to the patient. As discussed earlier, the digoxin, it's an inotropic drug. It does not reduce mortality. It only gives symptomatic improvement, and it should be given if there is associated atrial fibrillation in the cardiac failure patient. So this is a brief overview of which drugs are mandatory in the patients of cardiac failure and what are the first line, second line and third line drugs. And it also signifies the importance of a vaccination in the patients with cardiac failure to reduce the long-term mortality. Thank you so much. Please subscribe and like if you like this video.